Good morning. It's Let It Heal Live. Thank you for joining us. I'm Amber Korobkina, and this is Shannon Burnett.
Hello.
We have a different co-host, which we'll talk about in a second. I'm glad that everyone's watching today because we're talking about a topic that affects everyone, foot health. It's a really important topic. Some people might not even realize that they have problems with their feet, and some people do realize, and it's the only thing that they can think about, because when your feet ache,
Everything aches.
everything aches. And, if you've got a job where you have to stand on them all day, it's not really a very good situation. So I'm looking forward to getting into the nitty-gritty, talking about the different foot conditions that there are and what can we do to resolve them. And first, I'd really like to welcome you, Shannon.
I'm so happy to be here.
It's nice to have you here as a
you.
co-host.
I know, it's nice.
Because you've been on the show before, and we've talked
Absolutely.
about detoxing and
Child rearing.
child rearing, which
That was fun.
pretty funny. But yeah, so twice you've been on the show. It's nice to have you back.
Thank you. It's
And
great to be
you're
here.
going to be with us every week,
Absolutely.
which is cool. But where's Amy gone? We're wondering. Amy's busy.
Amy's busy.
She's in love,
which is great for her.
which is wonderful. And I'm sure that if I had asked her, she would have spared some time to come back on the show. But I'm excited to have a co-host that's also involved in the Bowen technique.
Absolutely.
Because
yeah.
we see eye to eye on a lot of things. And Shannon, you're actually really well educated too, which is
I'd like to think so.
which is fun. You can get a little technical and geeky sometimes, and I'll have to
I'll
bring
try
you
to
down.
tone that down.
But we're going to be talking about, we're getting into some more controversial stuff. Foot health isn't so controversial. It's exciting because we all have feet. Most people do.
And a lot of them hurt.
And a lot of them hurt. And I'm excited because one of the products we're going to be talking about is in my heart and soul, and yours
Absolutely,
too, I'm
yeah.
sure. I've seen so many people get happy feet as a result of it, so that's good. Next week, though, is cancer, which is a little bit more controversial. Week after that, arthritis, which again is another prevalent disease it's just on the up and up because all of the baby boomers have had such a fun life and they've abused their joints and they're paying for it. And then the really controversial one, and the one that helped us to decide to be controversial, MS is going to be on the 27th
great.
of October, and there's a lot going on in the MS world today with the alternative treatments and the surgery and all that. So that's what we'll be talking about for the next few weeks, and it should be pretty interesting.
It'll be
We've got
exciting.
various guests. Today's guests, we've got three gentlemen joining us. We've got a kinesiologist, Rob Burke, will be speaking with us all about what he knows with regards to feet and how they affect the body. And Roland Sempre is also coming. Now, he's a fitness guru. He also has his own TV show, which we'll be talking about when he joins us.
Looks like it's going to be great.
Looking forward to seeing that next Monday. And he's an acupuncturist as well. He's a personal trainer. You name it, he does it. And he'll be talking about how to keep your feet healthy and happy. And Patrick Mallory,
Good morning.
thank you for coming.
My pleasure.
It's nice to see you. I don't see you often enough.
My apologies.
Yeah, well, you're busy looking after feet, right?
Yeah,
And
exactly.
Patrick is a big part of Barefoot Science, which is the product that Shannon and I both love for helping
Very much
feet.
so.
And Patrick knows a lot about aches and pains in the body and the feet and all that sort of stuff. Now, have you ever had foot problems, Patrick?
Yeah, I have had.
You have.
So
What sort of problems?
A particular problem called plantar fasciitis. And
Okay.
basically, it's when your foot's in pain. The muscles in your foot contract, and it's just painful. It's like having toothache in your foot.
Ow.
So that's the kind of the pain image
Not
that you
nice.
get.
I've never had that, but no, is it on the top of the foot? I'm
No, it's on
being
the sole of the foot.
stupid.
It's on the sole of the foot.
I was going to do the same thing. I was like, can you
I hope
describe
I know
to
what
us what
that
plantar
is.
fasciitis is?
Yeah, it's on the sole of the foot.
Anywhere on the plantar aspect
Yeah,
of the foot,
exactly.
on the bottom
exactly,
of the foot.
Yeah.
So it's fairly common. I know. I've treated it a lot with Bowen.
Supposedly, it's basically 25% of the North American population
Wow.
suffer from it at one part or one point in their life.
And a lot of
That's
people
huge-
probably don't even know that they've got
It's
a sore foot. Right?
Exactly,
That's all they know.
exactly. It's a difficult thing to get rid of because you have to realize where it's coming from, and it's not always just the foot muscles. It could be muscles in the lower limbs that are not working properly.
Right. So if
So-
someone screwed their knee up for some
Exactly,
reason, the body
exactly,
starts to compensate.
exactly.
I've seen it with the hips too.
Really?
Where people, if your hips are skewed, right?
It's going to affect your gait.
It's going to affect the way that you walk, and
That absolutely makes
maybe
sense.
one foot's going to get flatter and the other one will get a higher arch. I'm not
Yeah.
sure what happens,
Yeah,
but
yeah,
I
yeah.
notice the hips have a lot to do with it. And you've probably worked on people with Bowen where it's totally resolved it.
Oh,
Sometimes it blows you away. And that's what I love about the Bowen technique, because there's certain times when the body corrects itself so quickly for something that's been around for so long. Most times, though, that's not necessarily the case. Or they might get a reduction in pain, but then they're going to go back to work in those work boots or whatever it is.
Do whatever they're doing that caused the issue in the first place.
And they're on those feet all day long. So this is where people start to hear ideas of maybe they should have orthotics in their shoes. And me as a Bowen therapist, I'm saying, no, take them out. They're gonna prevent the Bowen from doing its magic.
Absolutely.
And it's nice to have an alternative. I'd like you to introduce the idea of barefoot science and how that can help people with their pain.
Well, quite simply, it's barefoot science insoles do something that no other product does. It actually strengthens the muscles in your feet. You've got 20 muscles in your feet, and you're never going to exercise them because you can go to a gym. Do you ever see any exercise machines for feet? No. So what?
Aw, that's such a
Look
good
for
point.
neglected feet.
They get enough
But
work.
the reality is that our first introduction to life is through our feet. We get up in the morning, we're straight on our feet. And that's why all of a sudden we have these other products on the market like orthotics. We work differently to orthotics. Quite simply is we rehabilitate the muscles in the foot, whereas an orthotic will brace the muscles in the foot.
It does the work for them.
Exactly. I think there was a great analogy that you can bring to it, is that you're with trying to fix a problem, not keep it at its same level.
Yeah, status quo.
Yeah.
Yeah.
Yeah,
So-
exactly. And I know the example that I've used with people is, I think I've told you this one. I've probably told you this one, but the two ideas of the orthotic doing all the work for the foot, it pretty much lets the foot get lazy. We see what happens when the foot muscles don't work. I equate it to if your child comes home and they've got straight A's in English, math, and science, but they've got a D in French. You going to do the homework for the kid? You know, like the orthotic
exactly,
would
yeah,
do?
yeah.
Or are you going to give the kids some tools to strengthen their French skills so that they can bring it up on their own? And I find that barefoot science seems to teach the foot how to work properly again. And it's almost empowering the body to do its own thing, right?
Well, it's
So-
forcing you as you mentioned, the aging population. As we age, we wear shoes, and we're an obligation to wear shoes. Shoes act a little bit like a brace, like a cast. They're built in a certain way that our foot muscles don't actually work.
Right.
So they atrophy, which is a weakening of the muscles in the foot. So as you can probably find in your practice, as people get older, they have flatter feet.
Oh, absolutely.
So flat feet, your knees will go inwards. Anatomically, you'll push your lower back forward to compensate.
Yeah.
What our product does is it realigns those muscles. It takes your foot back to where it was when it was healthy. It rebuilds your arch. So by rebuilding the arch, it straightens up the knees, so the knee problems go. It straightens up the back, so the lower back issues go. And one more thing it does is the shoulders. Shoulder ache.
Really?
It's amazing.
Because the posture all of a sudden
Exactly.
is
We
proper.
did a study a couple of years back with some nurses, and 39% of them reported that they had reduced shoulder.
Wow. I want to talk about that study.
Yeah.
What we're going to do is we want to talk about exactly how barefoot science achieves this. I know that they're very affordable, so we'll have to touch on the price. We do need to take a short break, but I want you to answer the question about the studies and how they work and pricing, where people can buy them when we come back. So we'll just have
Awesome.
a quick break.
Thank you.
That affects almost 1 million Canadians today. If you have fibromyalgia, Let It Heal has a treatment that can help you. As advanced Bowen practitioners, we use a precise system of bodywork to initiate the body's ability to heal itself, with incredible results.
I've spent years looking for relief for my pain, and after only a few treatments at Let It Heal, the pain is gone and I can live my life again.
Call Let It Heal.
Do you
or
suffer from
drop by
back
their
pain,
clinic in
sciatica, or other debilitating conditions such as neck, shoulder, or foot pain? Find the relief you're looking for at Let It Heal.
As advanced Bowen practitioners, we use a precise system of bodywork to initiate the body's ability to heal itself, with incredible results.
I've spent years looking for relief from my pain, and after only a few treatments that let it heal, the pain is gone and I can live my life again.
That really was a short break.
It was very short.
Tried to field a few questions, didn't get to finish them. Now, do you want to ask your question to Patrick now? I'll just remind anyone that kind of missed the introduction, Let It Heal Live, we're talking about foot health. We're here with Shannon Burnett co-hosting, Patrick Mallory talking about the Barefoot Science product, and we want to find out exactly how these things achieve what they achieve, and your questions seem to be pertinent to that.
My question
goal.
was, now we were specifically talking about plantar fasciitis and a decrease in the arch, but my understanding behind Barefoot is that it works on many other foot conditions than just fallen arches or plantar fasciitis.
So like heel spurs
Yeah,
or hammer toes.
Shin
Or,
splints. Because what you're actually doing, Shannon, is you're recreating and rehabilitating those muscles in your foot. You've got 20 muscles in your foot. The foot muscles are all really controlled by one particularly long muscle in the foot, which is called the longitudinal plantar muscle.
what's it called?
Longitudinal plantar muscle.
Oh yeah.
And that's the muscle. If you can imagine the foot being my hand being a foot,
Right.
There's a large muscle that moves from the forefoot up to the heel, and that controls all the other muscles in your feet. And by controlling those muscles and rehabilitating those muscles, you're affecting the entire body.
Okay.
The entire body. A good example is that your ankles will become stronger. Your whole posture will be improved.
How quickly does this happen?
For some people, the results are pretty instantaneous. It starts working immediately when you put it in your shoe. You'll notice that your posture improves pretty quickly. From what we see is plantar fasciitis, about 3 to 4 weeks, you've got substantial reduction in pain. The real program, it's a 6-month to a year program.
'Cause we're rebuilding,
It's
yeah,
like
it's
going
not
to
gonna
the
happen
gym.
overnight.
It's like going to the gym. You're not going to expect, mega glutes in a week's time. You're going to expect them in 6 months' time. Be nice to have that.
But
Yeah.
with any natural therapy, we're not looking for an instant resolution of symptoms. We're looking at getting at the core issue that's causing.
Yes. I think the nice
issue.
thing is, though, people will notice results. They'll notice something is better.
Absolutely,
It's just
absolutely.
it's not completely better. Now, how does Barefoot Science do this? It would have been a great idea to bring the product with us.
Well, it's a very simple insole. It's a very simple insole that you pop into your shoe, and it's bought over the counter, and you can literally you pop it in and you forget about it, and that's the wonders of it.
Do
I
people
believe
notice-
there's one on its way, actually.
That's excellent.
Oh,
my
look at
my
that.
people.
Thank you very
There
much.
happens to be one right there. Thanks,
So
Roland.
this is a very used one, but we like the used one. So it works very much like a
Hold
gym.
it up. Here, can I have it?
Certainly.
Show it for the camera. So this is the part your foot would go on, and this is the underside.
And then you put
And there's
these
a little hole.
you put these little lozenges in there, or I call them lozenges,
Lozenges.
plugs. No, don't eat it, especially where it's been.
I was just going to say.
And this one says level 5 on it.
And that's level
So
5. So the product comes with a minimum of 5 levels, but we do actually go up to 7 levels. And the 7 level really addresses some of the problems that Shannon was perhaps
Okay.
inferring to. The level 7 is ideal for people with high arches. And in terms of population statistics, 80 to 85% of the population has flat feet as they get older. But the other issue that the other 15% have is high arches, which is a similar problem to flat feet, is that the muscle is becoming compromised, so
Exactly.
it's going upwards this time.
As
The
opposed to
opposite
falling.
way.
Exactly.
So
exactly.
would someone start at a different stage then if they had
No,
high arches? They'd still
not really.
start at...
No, your best. It's about compliance. It's like going to the gym. You're not going to bench press 500 pounds
Right.
the first day, and realistically, if you put level 5 in the first day,
It might be a little uncomfortable.
it
It's
would
too
be
much.
extremely uncomfortable. It'd be like walking around with a golf ball in your shoe.
it doesn't look very high to me.
It doesn't, but basically your muscles in your feet are so weakened as you've become older. And I say older, the problem starts really as soon as you put shoes on. We've got an ever increasing number of children wearing the product. The great thing about the children wearing the product is because their muscle memory is so active and quick, that they rehabilitate a lot quicker than, say,
Right.
a 50, 60-year-old person.
We find the same thing.
Yeah.
So,
So people shouldn't be putting those old-fashioned baby boots on their babies when they're learning to walk.
well,
they
the
should be
reality
letting
is
them.
if you've ever seen a baby take its first footsteps in a pair of shoes, it falls over forward.
Right.
It's not. We're anatomically we're not built to wear shoes with heels.
Yeah.
Or with.
Yeah.
Slight
Yeah, they
cushioning.
tilt us forward.
You know, if we go back to our roots, we used to wear animal skins on our feet.
It was just for
That's what we
protection.
used to do. You know, our philosophy is the best shoe you can buy is no shoes, barefoot.
Wow.
You know, we are just catering to the simplicity of the market, which is we're obliged to wear shoes. So, okay, why don't we exercise the foot whilst we're having to wear those shoes?
Well, yeah.
That's it.
Yeah. It's not the ideal situation where we're running
we
around with
prefer people
animal skins
barefoot.
on our feet.
Absolutely.
And that's where the idea developed, didn't it? Something about walking along a beach and realizing that the muscles work better when you're.
Well, it works. The system. The reality is that when you actually put the product in the first time, it's as if there's a term, a very posh term called a noxious stimulant, and really what that translates to is when you walk in soft sand, your foot tries to escape the sand, from the sand, so it's moving away from the sand. If you've walked on a beach for a while, your feet hurt, because your muscles are actually being activated.
And in a way they're not normally activated.
Exactly. So your foot muscles are trying to escape. So that the product works in a very similar manner to that. Is that because it's being stimulated, it's trying to move away, which is ideal. If you look at it, and I change the subject slightly, but if you look at it from a diabetic's point of view, big problem for diabetics
Oh,
is
yeah.
blood flow. Venous
Neuropathy
pooling,
and-
neuropathy,
Absolutely.
calluses. So if you have, and the product helps reduce friction in the shoe, is because you're rebuilding the muscles. Now, the only reason that you get calluses as a diabetic is because your foot is not in the right position.
Right.
And it's atrophied. A diabetic atrophies or weakens
Oh, their
weakens
feet
their muscles.
feel like rock.
Yeah, but then their
incredible.
muscles weaken at twice the speed of a healthy person.
Okay, yeah. Well, because they're not
And
getting the blood.
So
They're
if
not
you
getting the
can
blood
ima-
flow, and then they don't
Exactly.
feel anything, so they don't even realize that,
Yeah.
that
Exactly.
these feet are in
so
bad
you
condition.
can imagine their feet are being pressed down, they're getting flat feet, and then it's the friction that occurs.
Right.
You know, the reality is there's 70,000 people, 70,000 diabetics that get amputated every year in North America.
Wow.
Still in this day and age.
Unnecessarily.
Yeah.
That's the scary part.
There's a chain of events happens. There's atrophy or weakening of the foot muscles. It's
Friction.
clinically proven that neuropathy follows atrophy.
Mm-hmm.
Then you get the callus effect, which becomes an ulcer, and then also becomes gangrenous. and
Exactly.
Oh my gosh.
The reality that the next bit's the reality.
Well, once you get that constant friction, I would think over that callus area, it's bound to get infected,
It's
right?
bound to get infected. You know, our goal is basically we obviously sell the product to many different markets, but if I can stop one person from being amputated, then my product has done great.
So that's what this can actually do. If someone puts these in soon enough.
It rehabilitates your foot. So
That's incredible.
If you've got weak foot muscles, and everybody has weak foot muscles because you have to wear shoes.
Yeah. So
And-
like everyone should have these.
Absolutely.
Wow. Not just diabetics, not just people with sore feet,
That's
but
it.
get to it before. Don't
Yeah,
wait
they're-
until it's gangrenous and they're going to amputate.
Yeah.
That's pretty amazing. I mean, I
got
must
no-
admit, I don't recommend them to enough people. And they're affordable. How much would, no, you get 2 pairs in a set, right?
We do different offerings. The product can be purchased from most pharmacies in Canada, such as Shoppers Drug Mart and PharmaSave. Obviously, we sell a lot to therapists like Let It Heal. The price point is it's $49.95 for a pair from Shoppers Drug Mart. I think you do a double pack pair.
We do a double pack, yeah, Let It Heal.
Which is, I think, is $69.95. So
And it comes with all the little
it
inserts
comes with all
up
the
to level
all the
5.
little plugs up
Yeah.
to level 5.
And a DVD too, an
And a
instructional
DVD,
DVD,
yeah.
which is nice for people, and a booklet. But I think people like to be able to see exactly how to
Yeah.
use it, and a 30-day money-back guarantee.
Absolutely.
Which I like. I don't think anyone's ever taken us
no,
up on that
no, exactly.
because it always works. No,
So
it's not
we've
everybody,
sold over 500,000 pairs, and we don't get returns, Amber. It's because the reality is that you're exercising your feet. How can you, like, if I gave you a choice, what would you like to have? Would you like to have strong feet or weak feet?
Yeah.
Which one would you choose?
Yeah. Well,
And
and they feel better too,
Exactly,
right? That's the other
exactly,
thing. People,
yes.
the proof is in the way people feel.
Yeah.
Now, for someone though that has just dropped $600 on a set of orthotics, and they hear about this product that they can get a pair for $49.95, they're probably sitting there going, "Oh, well, it can't be nearly as good as my orthotics. Forget it." So, I'm sure that Rob, as a kinesiologist, can address that a little bit better. But it is something to think about, and then those people that truly believe they should be getting orthotics, and they've still got their $500 worth of coverage, would these be covered?
Not at the moment. Not at the
Okay.
moment. We're actually working on that presently. It's a long process with the government to get the product covered by insurance companies, etc. But
Right.
we're very confident that this will happen within the next 12 months or so.
Okay, that's good. Not that it's, I mean, it's
But then
a
the reality-
fraction of the price anyway. What's
But
the big
still,
deal?
$50 is $50, Anne.
Yes, yeah.
But the reality is that how many people? I'm not wishing to negate the orthotics industry at all. There is a solution there. I just feel it's a band-aid solution. That's the way I look at this.
Mm-hmm.
I'm looking at a proactive product that strengthens foot muscles.
Exactly. That's what your product
That's
is.
what my product does.
And it certainly does work. I can attest to that. I've never used them myself because I don't have foot issues.
But apparently
Sounds
it seems
I
like you should.
Sounds like I should. I'm just going to have to stop wearing sandals all the time. Although those 3/4 length ones would fit in sandals.
Well, we're actually coming out with shoes next year, Amber.
Sandals?
Nice.
Sandals.
Everything that
flip-flops.
has it built in.
Yep, it's
That's
built in.
flip-flops.
amazing. I'm
Yeah.
looking forward to that. So we've learned a lot so far about the Barefoot Science product. I thank you for joining
Thank you
us.
for having
We're
me.
going to be speaking to Roland shortly. We'll just have a really quick break, and we'll come back and we'll do a little seat swap thing. So thanks for joining us.
Thank you
and
again,
we'll
Amber.
talk to you
Thanks,
soon.
Shannon.
Okay.
Take care.
That affects almost 1 million Canadians today. If you have fibromyalgia, Let It Heal has a treatment that can help you. As advanced Bowen practitioners, we use a precise system of bodywork to initiate the body's ability to heal itself, with incredible results.
I've spent years looking for relief for my pain, and after only a few treatments at Let It Heal, the pain is gone and I can live my life again.
Call Let It Heal
Do you
or
suffer from
drop by
back
their
pain,
clinic in
sciatica, or other debilitating conditions such as neck, shoulder, or foot pain? Find the relief you're looking for at Let It Heal.
As advanced Bowen practitioners, we use a precise system of bodywork to initiate the body's ability to heal itself, with incredible results.
I've spent years looking for relief for my pain, and after only a few treatments at Let It Heal, the pain is gone and I can live my life again.
Call Let It Heal.
I did not mention when I did the introductions that we've got Sharon Danley coming at 11:30. I didn't have her written down because it's just a given in my head that she's going to join us. And Sharon does beauty tips, and today she's going to make it all about making your feet pretty.
Well, that's nice. Mm-hmm. Should have had her in the summer to make her.
Yeah, I
nice.
know. You know what? We should have had
Lovely.
these guys on sooner and done foot health or foot beauty tips sooner before the summer. But I think with the fact that it's getting cold, people are putting their shoes on again now. This is really good timing for a
Absolutely,
lot
yeah.
of people. Excuse me. We talked about coughing during the break, so now I've got a psychological
talked about
cough. So this is Roland Sempre. Thank you for coming and joining us, Roland.
Thank you.
It's nice to meet you. Roland is an acupuncturist. He's a personal trainer, basically a fitness guru. And I'm sure you encounter people that have foot problems.
All the time.
And tell me about what you do as this fitness guru. Are you in Toronto?
I'm in Toronto.
Okay.
I
I
have
can
a
tell that you're
location-
fit. You look very fit.
Well, thank you. I have a location in Rosedale at 1073 Yonge Street. We're on the second floor, and it's called Roland Sempre Rosedale.
Excellent. So people can find you there
They
if
can
they're
find me
interested
there.
in
They
getting
can
fit.
find me rolandsiempre.com. They can call our number.
And you have your own TV show, too,
and I
which
have,
is
yes.
called Revamped, and it's starting next Monday,
Yes.
October the 11th at 10 p.m. on Slice, which is maybe channel 41. in
Channel
Rogers?
41
If
on
you're
Rogers.
Okay. So I'm going to watch it.
Absolutely,
If I
yeah.
can, I don't have cable, so.
You can go to my house. It's okay.
Yeah, I'll have to come over and watch it.
Actually, I believe we'll be blogging live too during the show.
Oh,
there you go,
excellent.
yeah.
So what are you revamping? You getting people healthier? Is that what you're doing?
Absolutely. I mean, one of the reasons why I signed on to the show was that we were helping these women who had low self-esteem, low self-confidence. They were jilted by their ex-boyfriends or ex-husbands, and they needed a revamping of their lives, of their philosophy,
Wow.
of their whole attitude. So for 6 weeks, they're sequestered, and I take care of their fitness, nutrition, and life coaching needs. And Caitlin Regur, who's the burlesque dancing instructor, takes care of their burlesque dancing needs.
Wow.
And after 6 weeks, you have women who are empowered. They have a new attitude, change in philosophy. I mean, mind you, 6 weeks is 6 weeks, so you really can't do much.
Well, yeah,
but it's a great
still
foundation.
only 6 weeks, but they're sequestered for it,
Yeah.
so they're immersed in it, right?
Exactly.
Which is
They're walking the walk.
So it can't be too hard to find guests. People that have been jilted by guys or
I don't know
bitter
anyone.
or whatever. I think I can think of a few in this room.
We
at
got
this
a
table.
few people signing up.
Yeah, I bet you do. My God, if you need anyone, just
Yeah,
look at
just
my
give us a
Facebook
call, yeah.
friends. Anyway, so I'm excited. I can't wait to see the show. It sounds fantastic. I do want to talk to you about foot health, but it's probably a good time right now, because we haven't gotten there yet, to take a quick break and say hello to Sharon. Good morning, Sharon.
Hello.
Hi, how are you?
Hi, can you see me?
Yeah,
We can
we
see
can
you.
see you now. I've missed you over the
Okay, good.
summer. Did you have a good summer?
Yes, I did actually. How about you guys?
Yeah, it was really good. It was a
Too
lot
short.
of fun. A little bit too short. Yeah, it feels like it just begun. So you're going to talk about making our feet look good, right?
From what I understand, we want to look at feet from all perspectives, and not only the health and the care, but the beauty of feet too. Am I correct on that?
Absolutely. We just want to have happy feet. We want them to feel good and look good.
Happy feet. Yes, to be dancing all over the place. Well, from a beauty perspective, shoes are really big in most gals' closets, right?
Absolutely.
I have to really question a lot of the shoes in the fashion world, and we know that they're just made to sell. But when you have a shoe with a heel that's any higher than 1.5 inches, you're asking for problems.
I agree.
Yeah.
But we
And
all
I-
do.
We do it anyway, yes.
The ones that you wear to the wedding or the job interview or whatever.
I know, but once you get to, to that more mature time of your life, I think that you regret having crippled your feet earlier.
So
I
if
really
there were
do.
words of advice that you'd give, it would be throw them out right now, and none of us would listen
No,
because
we
we're
wouldn't.
not there
Yes,
yet,
of
and
course.
we'd still shove our feet into them.
I know that. So, given the fact that nobody's going to listen anyway, I would suggest that you wear your stilettos and pretty shoes as little as possible. Traveling to and from, wear a shoe that's comfortable, but if you're caught, it still looks okay. There's lots of great pumps or plain looking shoes, the plainer the better, that if you're caught without your stilettos, you still look well presented.
Excellent. What a good idea. It's simple, right?
Yeah.
So
Yeah.
while you're driving or whatever, or traveling
Yeah.
in any way, you put the comfy ones on.
That's right. And they don't have to be sneakers like they did in Working Girl.
I've done
they
that.
can
I saw
still,
that the other day, too.
they can still be a nice looking shoe that doesn't bring a lot of attention to the shoe. Just simple plain pump will get you anywhere. So that's
Excellent.
one of the things. Number 2 is you should change your shoes every single day. Don't wear the same pair of shoes 2 days in a row.
Okay.
And because it allows the shoe to breathe, and if you put shoe trees in your shoes when you put them away, you'll maintain the shape much better too. Your shoes will last you a lot longer.
Oh, that's good to know. That's very good
Yeah.
to know, because when you've dropped a lot of money on, well, let's face it, women probably have at least 20 pairs of shoes each.
At least,
I
yes.
think, maybe 40.
Yeah, not me, but most others do.
I know I have that
haven't-
many. I only wear the same ones
It's true.
every
We
day.
wear like
but-
5 on a consistent basis. But
Yeah.
you have to have one just in
You know
case.
something like you do with wardrobe, do you ever find that when you find that pair of pants or that blouse or top that fits fantastic and you love the feel and the look and everything, you buy a second or a third one?
Totally. Yeah, so
So
you should do it with
that-
shoes.
Yes.
What a good idea. Well, those are good tips. I love it. Thank you so much, Sharon. I didn't know what you would say for as far as foot health goes, but I think that's a
Yeah,
great
well,
one.
here's a couple of other little things. I notice that a lot of the gals these days wear, they don't wear a sock or a socket or a stocking or anything inside their shoes, and especially with leather shoes, and especially when it's hot, this is not a good sanitary thing to practice. You really should. Hose is good for the health of the shoe, the health of the foot, and it makes the legs look better too.
Oh, okay.
Yeah,
That's always a good
and I
thing.
can't tell you the number of women I see putting Band-Aids and things on their feet because they're, with the moisture of the foot up against the leather, you don't have the slide
Right.
that you need to have. And what happens is it rubs the foot and you create blisters and all kinds of things. So something to consider, even if you have like a little socket that you don't see, on the foot, but it's inside the shoe. That's at least something to consider doing.
Makes sense.
Yeah,
and you
absolutely.
can buy those cute little things at like Payless or whatever, where they just
everywhere,
cover the
yeah.
bottom of your foot.
They're everywhere.
So this is
They're
good.
everywhere.
We've pretty much used up our time, but those were
Okay.
4 fantastic hints that you delivered really quickly, and it was nice to see you again. It's been a little
Yeah.
while, and we'll see you next week. I'm not sure if you'll have any beauty tips relating to cancer, but
Well,
we'll see
as
what
far
you
as
can-
wigs are concerned and
That's
makeup
true.
when you're going through chemotherapy and stuff, you betcha I have
Okay,
tricks.
great. I'm looking
Perfect.
forward to
Me too.
hearing it. So have a great week, Sharon, and we'll talk to you next week.
You betcha. Goodbye, everybody.
Thanks, Sharon. Okay, good. Those were good.
Yeah.
Good tips, and I think I could probably take some of that advice. Probably you
Shoe
could,
trees, hadn't
too.
thought of it.
Shoe trees, good idea. They take up a lot of room, but we're still here with Roland. We've learned about his show, which I'm really looking forward to.
Me too.
And now I want to find out how. You don't talk to very many fitness trainers that are really into feet, but you're here on this show, so you must be. How do you tie feet? What's your knowledge of feet?
Well, I've been doing this for over 20 years, and it's all the same. Biomechanically, if there's something wrong with your feet, everything up the chain, there's going to be a problem with your knees, with your hips, with your low back,
Right.
what have you. And so it translates into huge problems for a lot of people, especially when they're trying to figure out what exactly the problem is, and very rarely do they point to their feet.
Yeah, they
They're
don't
always talking about
realize.
their
No.
knees. They're always talking about their back.
They're talking
and-
about what aches.
Right, and so those are symptoms of the source. And so, for the most of the times and most of the problems that exist out there, the source could most likely be your feet.
Wow, that's amazing.
I always take, working out is preventative. Exercise is preventative. Exercise is preventative treatment. I look at the Barefoot Science insole as preventative treatment.
Right.
And if you can get your feet in a position where they're balanced biomechanically and the muscles are firing and they're being stimulated and rehabilitated at the same time, then you're going to be much better off with less pain, better movement, and overall happy feet.
Happy feet, that's all we're
Happy feet.
looking
Yeah,
for,
we're looking
right?
for happy feet,
So
yeah.
you sell them then in your fitness center?
Definitely,
You have them
we
there.
sell them. We sell them. We have the active and the therapeutic ones.
Okay, yeah, there's different types. So
Right.
someone that's going to be working out a lot is going to want to have the active ones
And
in their
therapeutic
shoes?
as well. So
And therapeutic. okay.
as Patrick mentioned earlier, the therapeutic ones, they go up to level 7.
Oh.
For somebody who has a high arch, and
Right.
as was mentioned earlier, high arches are just as bad as flat feet.
Right.
In terms of the biomechanics and the pressures related to the muscles in the feet. So you want to make sure that you're strengthening and stimulating and rehabilitating, and that's the key with the Barefoot Science insole. It does all of that, and you're hard pressed to find another product that can do that.
That's pretty awesome that it can, and that it can treat the whole body. Just you put these in your feet, and it's helping everything. And you've seen these results too, obviously, with people.
Absolutely. I mean, I'm trained and certified and have degrees in a number of areas, and so I'm able to take a look at someone and assess them and figure out what exactly is going on, whether it's from a nutritional, a physiological, or a training point of view. So when someone comes to me and we do assessments on them and look at their gait, and we look at their biomechanics, and we look at all the other issues that are going on with them, and we have in our practice, it's an all-encompassing comprehensive practice where we have chiropractors and massage therapists and acupuncturists and shiatsu therapists and reflexologists and trainers and
Wow,
what have
you
So-
got it all.
One-stop
So
shop.
if someone were trying to recover from, if they just had a back injury that they're trying to recover from, you'd be able to help them to get stronger and look at it from all of those standpoints too then, right?
Absolutely. We're always
That's
looking.
nice.
We're always looking to treat the source.
Because I find that a lot of times when people recover from pain, they go, I'm not letting that happen again. I got to get
Absolutely.
myself in shape. But you got to be tentative, right? You've
Yeah.
had a sore back for the past 10 years, and all of a sudden you want to go to the gym?
Yeah.
So you do want... You
have to be
can't
careful.
just sign up for a Y membership and leave it at that, right?
No.
You have to be guided through it.
Yes. So you guys are good with that sort of thing.
Yeah,
and
we'll refer you to the right professionals and right down the hall.
Great. Get some barefoot science in their shoes right away.
Absolutely.
And
I don't, right now, for anybody who's training with me, I ask them if they're wearing orthotics, and I get them out of their orthotics and I put them in the barefoot science right away. I said, listen, and if we're going to get you to progress the way that you need to progress, then we need to make sure that your biomechanics are correct from the beginning, and you need to be in this product.
great. Do you get resistance?
No,
No.
Really?
no.
Well,
People pretty much tend to do what I tell them to do.
he's a little more intimidating
He
than
is than we are. Yes, you're right.
I was going to
Our clients fight us a little bit more.
It's not from an intimidation point of view, though.
I know.
They
I was gonna
realize
say, I wouldn't say no to him, but
they realize
might be
that when they take a look at everything that we do, and we walk the walk. And so the first thing they say is, well, are you wearing them? And I pull them out and I say, here they are.
Yeah.
yeah, you walk the walk with your barefoot science insoles in your shoes. That's the
right.
way to do it. Now, people don't have to work out at a gym for them to work, though. Like, they can put them in their walking shoes or their work shoes. and
Absolutely.
that's another way that they can get their feet fit. You don't have to be lifting weights while you do it. That's as soon as we talk about working the foot out, people can get a little confused and go, yeah,
Right.
but I don't want to lift weights. So
No,
it's
not a
walking thing,
requirement.
too.
I mean,
but
I'm also a
Definitely
dancer.
recommended.
I'm also a dancer, so I mean,
Oh, yeah,
I wear
Patrick
them. I
mentioned.
wear them when in my dance shoes. I wear them when I perform. I wear them
So
when
they'll
I compete.
fit in your dance shoes?
Absolutely. You just cut the insoles to fit the bottom of your foot.
cool. Yeah, you're dancing this weekend, right?
Canada Salsa Congress at the Harbour Castle Weston.
Oh, it's at the Harbour Castle. Even nicer. Wow.
I'm actually not dancing this year. We've got a booth, and we're selling barefoot science.
Excellent. Okay, so if anyone wants to see Roland in person, they can go down to the Harbour Castle. What was it?
Weston, the Harbour
Weston.
Castle Weston.
Right down Queens Quay, I think, is it?
Absolutely.
Yeah.
Cool. Okay, well, thanks for joining us. You've shared really good wisdom and information, and looking
Absolutely.
forward to seeing the show.
Thank you very much. Thanks for
And
having
just
me.
give us your website again. What's your website?
www.rolandsempre.com.
Excellent. And if
We'll
you
have
want
that
to see him
link.
again, he's at the Harbour Castle this weekend, and then Monday, October 11th,
Slice.
10 p.m. on Slice, you can watch Revamped and see Roland. Thanks for joining us.
Thank you.
We'll just take a quick break. That affects almost 1 million Canadians today. If you have fibromyalgia, Let It Heal has a treatment that can help you. As advanced Bowen practitioners, we use a precise system of bodywork to initiate the body's ability to heal itself, with incredible results.
I've spent years looking for relief from my pain, and after only a few treatments at Let It Heal, the pain is gone and I can live my life again.
Call Let It Heal.
Do you
or
suffer from
drop by
back
the
pain,
clinic in
sciatica, or other debilitating conditions such as neck, shoulder, or foot pain? Find the relief you're looking for at Let It Heal.
As advanced Bowen practitioners, we use a precise system of bodywork to initiate the body's ability to heal itself, with incredible results.
I've spent years looking for relief from my pain, and after only a few treatments at Let It Heal, the pain is gone and I can live my life again.
Call Let It Heal.
Okay, Let It Heal Live. We're back. We've spoken to Patrick Mallory and to Roland Sempre, as well as Sharon Danley for her foot tips. And we've got Rob Burke joining us.
Good morning.
Thanks
Yes,
for
still
coming.
good morning.
Yeah, it's
Yep.
still just barely morning. And we've been talking about foot health this whole time, and
Yep.
you've been sitting there politely. Now, Rob's the technical guy. You're a kinesiologist, and I know that there's a lot more to your background.
Yeah,
Tell me
I'm
about your
a
background.
kinesiologist, a U of W grad, specialized in gait biomechanics. But since about the age of 15, I started doing public speaking and science fair experiments, really on shoes.
Wow, so this is
kind of
your
my-
passion.
Well, and it was kind of, at that time, the footwear industry, specifically the athletic footwear industry, was becoming more marketing related. So there was this
Right.
perception or the optics out there where, like designing for Nike would be like designing cars for Ferrari.
Yeah, let's
Right.
make it look good.
So I went through all the hoops and
Wow.
then I found reality.
Yes.
Yes.
And reality is,
Reality is really shoes are bad,
yeah,
quite honestly.
Unfortunately.
And there's a lot of science, but at the end of the day, the CFOs, the shareholders determine what happens with most companies, and they go after what sells.
Absolutely.
And a lot of the companies do not push the limit because the concepts that are there in foot health and are there in footwear development are really about a century old. I mean, Dr. Scholl developed his first over-the-counter insole back in like 1912 or something like that.
Oh my goodness.
They haven't
and-
really changed that.
Well, that's
that
the
much.
interesting thing. They haven't changed at all. I mean, the
Wow.
diagnostic systems have changed. The materials of fabrication have changed.
Oh yeah, and
They'll
their
throw some
production
gel in
methods.
there
And
But the core philosophy that it's all based on
Yeah, it's all the same.
is essentially unchanged. Yet, 10 or 12 years before that, while he was studying in Illinois, he made this observation that many of the foot problems were coming about because of a weakening of the foot's arch system, the medial longitudinal arch system.
so he noticed that.
So on one hand, you notice that, and then on the other hand, you create a brace.
Right. Well, it's similar to what you said about, we were having conversation on the GO train,
Yeah.
and 2 ways to deal with a problem, right?
Yeah.
And you use the castle.
I use the castle
Analogy.
analogy, which is, if you look at someone that has a castle and they're being attacked, you can continue to support the walls as they're being attacked, or you can actually go out and deal with the attackers, right? If you
Sure.
keep supporting the walls, all you're going to be doing your whole life is
Fixing
rebuilding
walls.
these walls.
I'm snickering because all I can think of is the catapult with the cow on it.
From Monty Python, yes.
Over the wall.
Oh, it's always
great.
a good day when you think of Monty
Yeah,
Python.
Yes, yeah. But interestingly enough, I mean, I think really what's happened is the diagnostic technology at that time, I mean, muscle physiology, biomechanics, neurophysiology, all of those things 100 years ago were really in their infancy. So if something was broke, you braced it.
Yeah.
Yes.
Right? If,
yes. You don't look at what
And
the
that's
real
what
problem
they
is.
knew, and that was to the best of their ability at that time.
Sure.
it
That's
was
what
a
made
great
sense.
solution at the time.
Well, it was a great solution at the time, but then that philosophy gets embedded into academia.
Yeah.
And
Yeah.
academia continues to perpetuate the same beliefs. So guys like Root and then Kapunji and those guys, all of their teachings may be derivatives, but they're all kind of still based on things that were a century old.
You think about, though, when doctors learn medicine, everything else has evolved. Like whatever drug they were learning about 5 years ago, they're learning about a different one now. Why are orthotics still?
I think
In the
because
works.
it's a huge cash cow.
Yeah.
Yes,
it's
that's
a big
true.
cash generator.
And now
I'm-
it's approved, right, for insurance coverage too.
You know,
so-
I'm actually, quite honestly, most of the insurance companies right now are starting to pull back because within, or let's say over the past decade, there has been increased incidence, or at least the optics have been an increased incidence of overprescription. In some
Totally.
cases, like just outright fraud. The people signing prescriptions, the people doing the diagnosis and casting really weren't qualified. So I think really what's going on is the insurance companies want to pull back.
Yeah.
They want to offer something different, yet the insurance companies are not in a position where they want to be seen as promoting one product.
Oh no, of course not. And I'm sure there's a lot of red tape involved, even just in the pulling up process.
Yeah.
So
But-
Barefoot Science is the only product that does this, though.
And that's
so,
the catch. And that's kind of the catch, right? I mean, Barefoot Science is out there as a proprioceptive stimuli, right, to strengthen the foot, which is a fantastic alternative. Yet, because of the patent and everything,
Yeah.
it's the only product.
Yeah, that's a catch-22.
Yeah.
It's the
But-
best, it's the only, but they can't just.
But one thing that
You can't
Patrick alluded
monopolize
to
it, yeah.
earlier, and you guys have touched on, is the price. I mean, it's very price
Very
attractive. And in dealing with orthotics, because I did gait analysis, I worked in the orthotic industry. Most people's coverage at best covers 80%. So when they think, okay, $600 product, I'm still paying 20%, they're still going out of pocket $120.
That's true.
Yeah.
But they
And
don't
that's
look at
still
that,
more
right?
than what they would be paying for.
Well, yeah, they could be
Absolutely.
getting 2, 3, 4 pair of an alternative technology, which, quite honestly, is founded in much more solid science and much better from a physiological and philosophical point of view.
Wow. So it sounds like a good idea. It's just got to go through the works.
It takes time, and
Yeah.
the footwear industry has, the further conflict there is the footwear industry has looked at the orthotic and the podiatric industry for guidance.
Right.
So,
Yeah.
back in the day, every major footwear brand had, Puma had Peter Kavanagh, ASICS had Joe Ellis. There were tons of guys that were, leading the product development
Yeah.
of all these footwear companies. Yet their philosophies and science were embedded in something that was a century old.
Wow.
And then you go to school, and professors teach you what they were taught, and
Yep.
It
and
just
you,
perpetuates
It just
itself.
perpetuates.
and you get rewarded for how good you can regurgitate what they just taught you, and if you think outside of the box.
And people have, I mean, there are a number of my clients that wear orthotics that are hesitant to give them up because they have felt like they have needed them. And to be perfectly honest, because that tissue has become somewhat vestigial, they do to an extent.
Oh, they can't walk
need
without them. I know
Exactly.
people that have them in their, or they've been told that they can't walk without
Exactly. They've been
And-
told. And it's going to take some re-strengthening before they can walk without them without pain.
Yes.
And I think that's
Right.
the key thing. That's what I found, and that's kind of was the wake-up call one day when I was doing orthotics. Was this little old lady who was like, you know, Rob, these things are great. I get home, and most medical professionals who prescribe orthotics will tell you you should have a pair to put in your slippers or
Exactly.
to wear around the house, right?
Because they can't walk barefoot.
And all of a sudden there's that epiphany that, you know what, I'm creating this dependency that I
Yes.
might as well maybe stick a nicotine patch on top of it too.
Yeah, might as
You
well.
know, and a couple of syringes in there and really get them hooked. And, you know, it was just, you know, there's got to be a better way. So
Yeah.
then
well,
back in the
there
mid
is.
80s, you know, this is something that, you know, this whole biofeedback concept and
Yes.
and stimulating the muscles and looking at the foot from a totally different perspective is, you know, the direction we took. So as opposed even the way we look at the way the foot operates and the arch system of the foot, we've looked at it as 5 intersecting arches with one common central point.
Right in the center.
Which is also coincidentally where the foot center of mass is, which is also coincidentally where the body's line of action acts through, and which is also coincidentally the whole nerve engorged area
Right.
that's just, you know, sub to the plantar fascia. And it was like, you know, everything was pointing at this one area. There had to be, you know, it was like the
So it's
Bermuda
not
It has to
it's
mean
not
something.
coincidence.
Yes,
Yeah,
no, it's
exactly.
not
It's more than
So that's
coincidence.
why these inserts look so simple, right? It's like, wow, that can do all that. It's just a floppy insert with one thing that goes inside.
Well, yeah,
but
a
it's,
bunch of
it's because
progressive
everything
little things.
crosses.
Well, it's because everything crosses
there.
and everything in nature will move away from stress.
Right.
So if you can be strategic about how you introduce that stress, you can achieve certain results.
And that's why you have the level
Stasis.
steps. That's the
Yeah.
strategy portion
Right,
of
and
it.
you know, if I put steel on your teeth and some elastics on it, I can reshape your jaw
Yeah.
to straighten your teeth, and it's exactly the same kind of philosophy at the muscular level. There's a lot of things happening with Golgi tendon organs and muscle spindle fibers and
Oh, yeah, it's
the
going back and forth.
mechanoreceptors and stuff like that.
Yeah.
That you introduce that stress and the muscles respond and activate.
Well, I think the technical explanation will definitely be helpful for some people. And some people are probably
most
sitting there
people-
going,
What are
I
you
have
talking about?
sore feet.
Most
When
people,
can I
yeah,
get these? I
exactly.
want to get these
Yeah.
these inserts for my shoes, and I'm not sure if we mentioned it's barefootscience.ca, and you can go there and get information, or they sell them at Shoppers.
Yeah, I think Patrick kind of covered the whole gamut. You can get them online if you just do a search online, type in Barefoot Science.
Barefoot Science. We sell them at our
Shoppers.
clinics
We sell the
too.
dual pack at our clinics.
Burlington and
Yeah, a number of
Kitchener.
chiropractors in Toronto.
Roland has them at his gym.
Yeah.
So everyone in this room has a connection to Barefoot
Yeah,
Science.
some independent footwear sellers. Yeah, I
Yeah.
mean, for me, it's been interesting because I sat on that other side of the desk.
So you
Right.
had the foot issues.
Oh,
Is that what you
and
mean?
he was dealing
No, but
with
I
the
was doing
orthotics.
orthotics.
Oh, that other side of the
And I
desk.
was,
It's a
and I
three-sided
had,
desk.
whoa, and I had foot issues too. I mean, I have.
Oh, I want to hear about your foot issues.
I mean, I have a spurring on the big toe, the hallux of my left foot.
Mm-hmm.
And when I
Oh.
think back, it comes specifically back to one specific pair of basketball shoes I had in university.
Wow.
That when I go back and think about it, and it's really just proof that, and you touched on it, Sharon, with the blisters, but whenever there's a conflict between the way your foot wants to move and the shoe's ability to allow that to happen, you could get blisters.
Yeah.
Or at even a more subcutaneous level, you can start having the bone react to it, and the bone's reaction to that micro trauma is to lay down more bone material.
Right, and that's
So you get the bunion.
So things like bunions, the shape of the toe, flex points in the shoe, and all that stuff. So I mean, for me, it came right back to, and I know exactly the pair of shoes. I know where I bought them. I know what I paid for them. And,
Wow, but there's
and it was a
no
function
rewind
of marketing
button.
because at that time Dr. J wore them, so that was good enough for me. And
Wow.
you know, and he might have
Well,
problems too.
no, do you still have that problem, or when you have your Barefoot Science, does it feel okay?
Oh no, it feels okay, but I mean, there's still a spur there. The thing
There's
about
still a spur.
the thing about a bunion or a spur, the only real way you're going to get rid of it is to go in and
have it surgically.
with a Dremel. I mean,
right. And then there's not as much movement in the toe anymore, though, when someone gets surgery,
it depends if they have to
right?
damage the capsule I
Okay.
mean, where mine is, they may not damage the capsule, but on a typical bunionectomy or bunionotomy, or whatever it's called, I mean, they may have to break the toe, damage the capsule. But, there's fantastic guys in Toronto that are doing minimal incision bunion stuff now.
So there's more up-to-date stuff. There's also, to get off the topic of barefoot science, I have seen some results with Iodex, and this is something that we should put out there. Just a little ointment that you can get if you go to an Indian grocery store. It comes in a little brown tub, and it's got a green lid and a green label. And I think the active ingredient would be the salicylic acid. Or
I think so. There's also there's an herbal blend in there as well.
there's an herbal blend. It smells very mentholy. So if you've got bunions, you'd soak your feet in warm Epsom salts every single night for 20 minutes. That's going to draw out a lot of the toxins and the acids. You rub the Iodex in
on the bunion,
right on the bunion.
So it's going to go through the skin.
It penetrates and it kind of it eats away at it softens it, and then your
like
body
little bone nibblers.
like little
Yes.
bone nibblers. That's what they should have called it instead of Iodex. Little bone nibblers.
Little bone
And it's
nibblers.
like $3.99 for a tub of this stuff.
Yeah, it's
you
dirt
just have
cheap.
to have the the commitment to
Yes,
do it every
you have
night.
to.
You should try it.
But also, then what a lot of people need to know, right, is the bunion's a symptom
exactly.
Well,
of
yes.
something else, right?
Yeah.
Yes,
So
so-
you can do that, get rid of that osseous or that calcification.
and then get rid of the
that's-
shoes associated with
And
it.
then get rid of the shoes, correct the
I
biomechanics
think
that
most
cause the
people
bunion.
have gotten rid of the with me, the most bunions that I see are older women, and by older I mean
70.
probably 70, and they used to wear the little
Those pointy
the
toe.
pointy whatever you used to call them, and they
I was
can't
a-
even get shoes on now.
I was a door-to-door milkman.
Oh wow!
Oh, so you walked a
okay.
lot.
So I
Yeah.
also saw those nice little old ladies who would come to the door for their half and half cream
With those pointy shoes.
No, they should have had the shoes on because their feet were like.
Ooh, you got to see their feet.
So I got to see the result of the pointy shoes. But I was also at a bar mitzvah for a podiatrist's son, and he thanked the women in the audience for their high heel pointy shoes because
Kept them in business.
kept them in business and funded the bar mitzvah.
Oh my god,
So
that's pretty bold to come out and say it.
I think it was said tongue in cheek, but
Exactly, yeah.
Oh, that's
if you
cute.
drill a little deeper into the statement, you realize that
Absolutely.
there's good money to be made there, and that's I think even part of the problem with an alternative technology that's cost effective. The logical point of penetration is to go to the medical professionals who deal with foot health, but then you have to convince them how this can be a revenue stream,
Absolutely.
right? As opposed, I mean, ethically, they should just be helping people.
They should be, and in most cases they are, but they
But
also
they're
need to put
helping
food
the
on the
Mercedes
table.
dealership, and they're also
And they are thinking of it globally as well as, I mean, this is a big economy, right? So it's hard to just cut it under at the
Yeah.
knees, right?
Well, I'm impressed with how much a Barefoot Science product does at such a low price. Something
Yes.
that helps so much, you would think it would cost 10 times more because you equate. It's so funny when people shop. Sometimes I buy the higher priced pair of shoes or makeup or skin product
better.
because it must be better.
Well,
And
and I have a friend who is exactly the opposite philosophy. He will not wear anything branded.
well, good for him.
He's
Yeah.
like, Nike's
He's
not
better
paying
off.
me.
Yep.
These people are not paying me to advertise for them.
Exactly.
So why should I pay a premium for? And in a lot of cases, specifically with footwear, oddly enough, that century-old philosophy of that stiff, stable shoe tends to equate to the more expensive shoe.
Yes, the Italian leather, and
So if you get
they're always
into-
stiff, so they're damaging the feet.
They're damaging
Fortunately,
the
those
feet.
people can afford as many pairs of Barefoot
Well, maybe,
Science later
They
on.
get
maybe
careful.
not because they're spending all
They
that money on
spent it all on the
shoes.
shoes. Anyway, we're almost out
Yep.
of time. I think we've.
Yeah, I drifted away from foot health there.
But that's okay. No, we talked a lot about the important stuff and how it helps and how you've been on the other side of it.
So be barefoot and exercise your feet. And
If
when
you
you're not
can.
barefoot, put something inside your shoes that
It's going to
that
re-strengthen.
helps exercise those muscles.
And stay away from the stiff shoes too. Try and get something that's pliable, right?
Yeah, yeah.
And if you do have to wear stiff shoes, make sure you've got your Barefoot Science
and
insoles.
you know, and make sure the shoes fit properly. That's the big
Right.
thing too. I mean, coming from an athletic background, people with skates, ski boots, even my track spikes, the mentality when I ran track was this thing should be so tight to the foot.
Well, yeah, and the same thing with skates.
And the same
too.
thing with skates, and really, it's a cast,
not the case.
right? So it's like putting your body in a straitjacket for 40 years of your life,
Yeah.
and then wondering why the muscles atrophy.
Yeah,
So
no
that
kidding.
whole mentality of the shoes being really tight, stay away from.
Yeah, yeah, I'm in agreement with that.
Absolutely.
And the other point that we touched on too, for people that maybe watching, I think most of the people that will be watching do have foot problems. But if you don't have foot problems, or if you don't think you have foot problems, and you got a sore knee or a sore back or sore shoulders or whatever, it might be because of your feet.
Exactly.
So
Well,
consider correcting your
This
feet.
is preventative medicine.
Absolutely. As is working
yeah,
out,
yeah.
as is so many things. And we're out of time, unfortunately. I just wanted to get those last few lessons to sum it up so that anyone that's out there experiencing problems has somewhere to start. And definitely Barefoot Science is one, and all of those other tips too. So thanks for joining us and giving us all
Good
that
being here.
technical info. And I know that there's more videos and stuff on the Barefoot Science website for people
Yeah,
that
I
want to
believe
learn
so. And
more.
actually,
and
I believe there's a lot on YouTube now too.
the nurses study that that blew me away, all those nurses that
Incredible.
usually have such bad foot pain, is also outlined on there. And thanks for co-hosting.
I love being here.
Yeah, you look right at home, actually. You look pretty relaxed. So we'll have you here next week when we talk about cancer.
I know that'll be exciting.
Yep, I'm looking forward to it. Thanks for joining us. We'll see you next Wednesday at 11 on thatchannel.com.